Hello and welcome. I'm Dr. Jeff Daly. I'm a Harvard-trained, board-certified child psychiatrist with over 24 years of clinical experience. I've decided to develop these educational videos as through the years, the one thing that I've learned time and time again that the most important part of my job is to help a parent have a better understanding of their child. If the parent has a better understanding of the child, they can then be empathic towards the child and definitely can help the child move forward. Today, we're going to be talking about one of the most common conditions in child psychiatry, attention deficit hyperactivity disorder. While it is very common, it is also very misunderstood. Time and time again, I will hear from folks saying, oh, my child doesn't have ADHD, they're just lazy. My child doesn't have ADHD, they just make bad choices. Um, ADHD is a neurobiological condition that commonly affects close to 7 to 10% of the population worldwide. So, what is ADHD? As I mentioned, ADHD is a neurobiological condition that comes in three different subtypes. The most common subtype is a subtype of hyperactivity, impulsivity, and inattention. This results in about 85% of the cases. The second most common subtype is a primarily inattentive subtype. So the child is able to sit still, the child is able to not be fidgeting and touching everything, but really struggles with inattention. And when I talk about inattention, I'm talking about a term called directed attention. The way I have my families understand what directed attention, it's what we use when we fill out forms. It's what we use when we're doing paperwork. It has nothing to do with fascination. And I mention this because it's an important clinical issue. So often parents will say, my child can play Minecraft for 5 straight hours, yet can't finish a math worksheet. So my child has no attention problems because they can play Minecraft. Well, Minecraft has to do with fascination, not with directed attention. The math worksheet has to do with directed attention. So if it feels really good while you're doing it, it usually has to do with fascination. And for adults, when they think about that, doing paperwork usually doesn't feel really good. You usually have to crank it out, um, lock down, have the least amount of distractions, and then you feel a sense of, it's over when it's done. That's when we're utilizing directed attention, and that's the deficit that so many of these children have. The third subgroup, which is much less common, only about 5%, are kids who really struggle with impulsivity and hyperactivity, but are able to sustain attention. So those are the three subgroups. The condition has to be present for at least, these symptoms have to be present for at least 6 months. So it's not just a reaction to a situation, a separation, a new school. These are more chronic conditions. They have to start at a very early age. So there has to be some evidence of these symptoms prior to age 12. Um, these symptoms have to cause dysfunction. In psychiatry, whether it's anxiety, depression, inattention, hyperactivity, we've all experienced some of these symptoms at one time or another in our lives. But when these symptoms are significant, persistent, and lastly, when they're causing functional impairment. And the functional impairment with ADHD is commonly academic impairment, clearly, some behavioral impairment, but also a real significant one is the social impairment that these symptoms cause. Other kids really struggle with another child being inattentive, hyperactive, and impulsive. Not only do the parents and teachers struggle, but their peers also struggle. So these kids can commonly be socially ostracized. I'm often asked is how common is ADHD and is this just a phenomenon in the United States? And as this slide indicates, ADHD is a very common condition. The estimates are 7 to 10% of the population worldwide. And in every country it's been looked at, there is evidence of children and adolescents and adults having attention deficit hyperactivity disorder. This is not just a condition of the modern world. It is not just a condition of the United States. It's present throughout the world. What is the common course of this condition? I'm commonly asked by families, what's going to happen to my child over time? As the previous slide indicates, um, what happens first is the hyperactivity and impulsivity improve. And this is really important clinically because commonly we're called to see patients who are really struggling in middle school, who give us a history of ADHD and now are really struggling. And when we look carefully, what we find is the ADHD has continued, ADHD that was diagnosed at age 7 and 8, but it's changed in the sense that the hyperactivity, the impulsivity, the inability to sit still in your chair, to move around, to be touching everything has gotten better. But the part of ADHD that continues is that inattention. And right at a time when they are in middle school, when they have 7 or 8 different teachers at the same time asking them to do assignments that are much more difficult, that call for planning and thought. Um, and so at this time, that inability to sustain attention tremendously impairs their ability as a student, leading to real demoralization, frustration, and oftentimes the child just giving up. What are the neural biological underpinnings of this condition? What we understand so far is that ADHD is not a result of inappropriate brain development, but an immaturity in brain development. In particular, an area of the brain called the frontal lobes, the area right behind our forehead, is maturing at a slower rate in individuals who have ADHD compared to their age-matched peers. What that part of the brain is responsible for is the ability to plan, to focus, to have self-awareness of what you're doing with your body. It helps us to sustain directed attention. It helps us to evaluate information and think how to emotionally react before we do in an impulsive way. So it really is the cornerstone of assisting us with these symptoms of ADHD. As this next slide shows, that part of the brain, as we look at this slide, the more purple the brain, the more mature, the more purple-blue the brain is, the more mature. The brain develops from the back to the front. In the back, you'll see right when a child is born, that's where the vision center is. And that newborn can see the mother, can see the father, can see the feeding source within the first few hours of life because the vision center is in the absolute back of our brain. If we see that child at age 4 or 5 running around a playground, they have incredible dexterity. It's hard to keep up with them in the playground because their motor strip is maturing at that young age, allowing them to run around and to be very agile. When we get into the age of 12, 13, that's when our emotion centers are developing. It can be a really challenging time for parents in their adolescence to work together because the adolescents start to feel very strongly. They have a great sense of wanting to do things themselves. They begin to not listen to the parents quite as well at this age, which is a normal part of development. And then lastly, the last part into your late teens up to your mid-20s, that front part of our brain finally fully matures. It's that maturation that allows us to take in information, think about it, analyze it, and make a right, thoughtful decision. What it feels like is maturity. And it's not just maturity of the individual, but it's really maturity of the frontal lobes that results in kids being able to process the information and make the best choice. How is ADHD diagnosed? At this point, there is no blood test, there's no imaging study that is going to definitively diagnose ADHD. ADHD is a condition that is clinically diagnosed, meaning you need to be working with an individual who has experience evaluating and diagnosing ADHD. Information is gathered through direct observation of the child, history gathered from the parents regarding social, medical, developmental history. Quite often, rating scales are used that have been used to assess ADHD. Commonly, a common one is the Vanderbilt scale, which is handed out to the parents and to the teachers or other caregivers, such as grandparents, nannies, babysitters, who spend quite a bit of time with the child. These rating scales assist us in the diagnostic evaluation. And lastly, as this slide indicates, ADHD has a lot of comorbid conditions. So if you're a child who has ADHD, there's about a 70% chance you may have another diagnosis, including oppositional defiant disorder, depression, anxiety, a tic disorder. Um, Only about 30% of kids have what one of my professors used to call ADHD simplex. They just have ADHD and no other conditions. So as part of that assessment, it becomes essential that we look for some of these other diagnoses because if they are present, they have to be addressed along with the ADHD. In the next video, we are going to talk about treatments for ADHD. Thank you for listening and learning about ADHD, and I hope you will partake in the next video series. Thank you. I'm Dr. Jeff Daly.